So let's move on to symptoms. The most common symptoms are fever and dry cough. Around 90% of those with COVID-19 will experience fever, and about 7 out of 10 dry cough. Fatigue is also very common, with 4 out of 10 people experiencing fatigue. A noteworthy point is that, particularly in the elderly, there may be more covert, subtle symptoms of COVID-19. For example, if you have an elderly relative complaining of fatigue or describing a loss of appetite, perhaps aching of the joints and muscles, I would assume they have COVID-19 until proven otherwise. Other common symptoms include headache, shortness of breath, and a loss of sense of taste and smell. An interesting point on that is the South Koreans have been doing a fantastic job of testing their population with around 15,000 tests a day. Their data so far shows that 30%, approximately 1 in 3 of positive confirmed cases reported that they had a loss of sense of taste and smell. That's quite a common symptom, and it's quite an unusual symptom to otherwise experience. So if you have that alone, you should still assume you have COVID-19. Other symptoms which are rarer may include nasal congestion, aching of the muscles and joints, and very rarely gut-related symptoms such as nausea, vomiting, or perhaps diarrhea. But it's important to note that these rarer symptoms are likely to be associated symptoms with the more common symptoms. So if you had, for example, some nasal congestion on its own or some diarrhea on its own, it is highly unlikely that you have COVID-19 and much more likely that you have something else. The other important point is that you may experience no symptoms at all. At least 20% of the population who get COVID-19 will not have any symptoms at all and feel totally well in themselves. And in fact, there are many reports that this figure is a gross underestimation, and that there may be a high percentage of people who are positive on testing who actually would say they've had no symptoms at all. So that's important to remember. Of course, all of these symptoms can be early warning signs for more severe illness down the line. And one thing that has been noticed is that people can quite rapidly decline, with shortness of breath being a key feature. And of course, end complications can be SARS, severe acute respiratory syndrome, pneumonia, which is essentially inflammation of the lung, and even kidney failure. And of course, ultimately, sadly, in a few patients, death.